Welcome to Convo. We've been having conversations around recovering from substance use disorders the whole of this month because that is our theme for the Mental Health Awareness Campaign this year. My name is Frida and this is Convo, encouraging conversations that matter. You know, we are looking forward to a future where we can have these conversations more often without stigma, without uncertainty, and without sounding controversial. So that is why we are having these conversations. And today, I'm joined by one of my friends in studio. His name is Jeff. I'll be letting him introduce himself to us and tell us what he does professionally. So, karibu sana, Jeff.
Asante sana. So my name is Jeff Kipsang, aka Jeff,
Yes.
as she has said.
Yes.
I'm a nurse by profession, and I really love it, and I do it with my passion. To some extent, I do say that is a calling too.
Yeah.
Yeah.
Wow, amazing. So it seems you're enjoying medicine.
I really do.
Yeah, some of us have been enduring, but we thank God that you're here. Karibu sana, Convo.
Asante sana.
I'm amazed that it's your first time here.
Yeah, it is, and it's a privilege. It's an honor being here and be hosted here too.
Yeah. So this year we decided to talk about substance use disorders because we realize it's become a major concern, not only in our country, but even globally. A lot of people are suffering from drug and substance use disorders, and we are losing a lot of lives to it as well. And because around in our circles, these conversations are not held openly, people feel stigmatized, even when they want to seek help. And you and me being in the healthcare setup, you know, I'm a medical student, but you've been practicing as a nurse for some time now. I wanted us to have a conversation about how we've seen these cases being handled and how we think they should be handled. So I would ask this, Jeff, have you encountered a case of substance use disorder before in your practice?
Yeah, I have quite a number of them.
Okay.
I remember there's a day while in duty.
Yes.
There's a guy who I won't mention for some reason.
Yeah.
He came for some medical complications.
Yeah.
And after we've talked for quite a long time, a discussion, then he was accompanied by the wife. The guy was married.
Yes.
But to some extent, in the midst of our conversation, he wrote something on a notepad, and he gave it to me. And when I read it, the writing was saying that I want to talk to you alone.
Yes.
So because of confidentiality of the patient, which I have to, I had to, in a better way, to ensure that the wife is out of the room. And we tried to talk. Then after talking, only to realize that he's also abusing drug, and he didn't want the wife to know.
Okay. Yeah, I can imagine because he thought he needed help, but he didn't feel free to ask for help openly.
Sure. Yes.
Yeah, so now I want to give you a hypothetical situation, and I want to see how you'd handle it, and then we'll talk about it from there. Imagine somebody walked into hospital and you're asked to manage them or to help in their care, but they came in for burns. Let's say they have maybe second-degree burns on their hands and face. And then in the course of their treatment, you find out that maybe on day 3 or day 4, they start experiencing very weird symptoms, what you'd think is withdrawal symptoms. And after probing further, you find out they actually have an alcohol use disorder. And you know, as we had this conversation at the doctor's bench some time back, we realized that patients don't like being asked, have you ever smoked? Do you use alcohol? They don't like that question.
Truly.
Yeah, so maybe that question was asked before, and in their file it stated that they don't use alcohol, they've never smoked. So how do you go about it from there? Do you go like, mbona hukuniambia unatumianga pombe, or what do you do?
It's a nice question. Being in such kind of a scenario, one, you have to reassure this guy, you have to reassure him. First, you create a rapport with him or her. Find out the reason why he or she is trying to cover it up, or the reason why he didn't bring it up at early stages. So after doing that, you create a friendship environment, you talk to this patient or client or viewers. Then things are usually revealed at the friendship level. whether you are a patient or a medical practitioner, you have to create that
friendship, a
environment.
relationship, yeah.
Because I think that are of benefit when we take history of a client or patient. And to some extent, others won't say until they have confidence in you, until you develop trust in you, and the two will only be brought out when you have created a friendship environment.
Okay.
Yeah.
So I think I'm learning something there. You know, as a doctor or as a nurse or just as a healthcare worker, a relationship with your patient is very
Really,
important,
really matters,
such that they feel safe to give up these details. Because I think a lot of times when you're asking them questions, they feel like we are judging them, like, do you smoke?
You're asking too much.
Yeah, like you're probing too much into my personal life, yeah? So as a person and maybe in your career and in your workplace, do you feel like you're equipped to deal with these cases? Do you feel like there's a gap or are you okay?
I can say I'm well equipped to handle such kind of cases, but it only happens when you learn the basics.
Yeah.
You learn the basics, how to create a good rapport, how to make a patient have confidence and trust in you, because those are the basics. First, you develop the trust, you develop the confidence. Now, from doing that, now it comes to a medical point of view.
Yeah.
Now, when you come to take the history of your patient or client, he'll be open enough because he'll have the feeling that I'm talking to a friend.
Okay.
I'm talking to a person who understands me well.
Yeah.
And this guy, this is between me and him. You get the point?
Yeah.
Now you'll be in a position to share a lot. Don't forget the fact that these guys who are involved in SUDs, to some extent, they fear sharing out because of stigma and because of they feel that you will go and share it with a relative or with a friend. So because of such kind of reasons, they tend to hold that back. So once you've created a good environment, now the medical part of you, it's a secondary thing. But the social part of it is key.
Okay. So I think some of us have it inverted. So we want to deal with the withdrawal symptoms, the medical perspective, and then now go handle the social later. But it's very important to have, you know, your patient assured that you're going to keep it between you and them, and then also find out why they feel the need to hide. Do they want help? Have they sought help before? Things like that. So my last question: what are some of the things that we do as healthcare workers that make patients want to hide? Because I don't understand why patients feel the need to hide. Okay, I know there is a lot of stigma, but I know that there are other places that patients go and just talk about this openly. But when they come to hospital, there's that feeling like, I can't say this to my doctor. Yes, your doctor or your nurse is the person who's willing to help you. But what are how have we contributed to this stigma as healthcare workers? What do you think we've been doing wrong?
Let me just pose this question. Have you ever been in a place, in a scenario where you need help? The person to offer the help is around, but you feel like he's not the right person? Yeah. At some it happens because one, the expression that we portray to our client or patient, these guys, they are adults, they are learned, they are elites. So they have to see that this guy is a professional and is in a way in a position to give me the right thing that I need, the healthcare service that I need. To some extent, the approach is key. The approach is key. You have first to bring down yourself to that scenario. You have to empathize. Not to sympathize, but to empathize with your client or patient. Now, when you now come down to that level, your client you will be now creating a good environment, the confidentiality point of view, and the trust in it. Now, when he's comfortable, and you've convinced him you're in a professional, that is now the basic thing that we can approach that. And to some extent, because we have to appreciate the fact that some medical practitioners are also arrogant.
It's true.
We rush in judging them. We rush to coming up to conclusions, not forgetting that we need history from this guy. And by them giving us history, it is not to, it won't benefit them only, it also helps us when we come up with statistics, and also it is our role to ensure that our patients or clients have met all the necessity as terms of their medical need is concerned. You get the point?
Yes,
so
I do.
our arrogancy point of view and how we approach things, they are really, really key.
Wow.
Yeah.
So I think what I'm learning today is, as a healthcare worker, there is need for you to know that it's not about you.
Yeah.
It's about the patient.
Yeah.
So don't be arrogant. You know, create a relationship with them, provide a safe environment for them to express all their concerns.
Yeah.
And then something else I'm learning is that it's not our place to judge.
It's not our place to judge.
Whatever circumstances that led them to that SUD, substance use disorder, is not our place to judge. It's our place to help them. Wow.
Wow. Now, just to add on it, you know, we should handle this in a point of we are helping this guy to heal.
Yes.
Regardless of what he or she did while under the influence. For a scenario, if you've met a client, he was under the influence of alcohol or rather bang, and he created some kind of chaos somewhere at home, and in the midst of it, someone was injured, badly injured. Maybe to some extent, maybe one has lost his life. Now this guy has been brought to the hospital. He is a criminal, but you don't have to handle him in a perspective that this guy is a criminal.
Okay.
You have to handle him in a way that I'm helping him to heal. It's more of prevention than harm. You get the point? We're trying to make things better.
So regardless of who the patient is, what they have done under the influence of the substance they were using, we have to treat them, you know, do no harm.
Do no harm.
So it's not my place to be telling them, I want you to get healed so that you go to jail. Or, you know, mistreating them because we have heard of what they did. So it's our place to just help them heal as a person, regardless of what they did. Wow.
And that is how where professionalism and calling comes in. And also to some extent, patience.
You need patience. You need a lot of patience to deal with these cases. So, Jeff, our time is up. Thank you for being here. But I want you to give a parting shot so that we call it a day.
Just want to say this. At this era or this moment, a lot of youth losing focus. We engage in things that harm ourselves. They are, to some extent, they cost us our vision. If you find yourself in such kind of a scenario, kindly just get someone you can share with, a professional, and don't rush or being convinced that drugs, it's a permanent solution to what you're going through. And as a matter of fact, involving in drugs when you're in that kind of a scenario, it will only make things worse and not better for you. So with that many remarks, I wish you a happy Easter. And I'm very happy, Dr. Frida, hosting me here. It's a pleasure and a privilege.
It's always a joy to have you guys at Convo. I look forward to having more conversations with you in the future.
It's a nice conversation, and we should be doing this more often.
Absolutely. Thank you for staying with us. My name is Frida. I was hosting Jeff, who is a nurse, a practicing nurse, and this is Convo, encouraging conversations that matter. From me, for now, it's a shalom, bye-bye.